Good evening and welcome to Aging Matters. This is a program that is provided by and sponsored by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Public Advocacy and Outreach Manager for the agency. Our show is fascinating, interesting, and it's on the CARE Act. And so to tell us more about that, my guest tonight is Ray Landis, AARP Pennsylvania Advocacy Manager, right?
That's right, yes.
Good. And so basically you're a representative of AARP to help us, I'm hoping to learn a lot or a little bit about the CARE Act. And I think that I want to kind of build a little bit before we start talking about that. You provided me with some information, Ray, earlier, and I wanted to share this with the audience that Pennsylvania is the fourth oldest population in the nation, and certainly the age is just going to keep going. We're not getting younger. Unfortunately,
no,
we're
unfortunately, and we're actually on the precipice of a real increase in our older population. We've got about 17% or so of our state's population right now is over the age of 65. By 2025, it's going to be 25%.
Wow, that's a lot. Okay, so I think that as we look at that, that brings considerable challenges, considerable situations for all of us as at the Berks County Area Agency on Aging, but even for the state of Pennsylvania itself, looking at the fiscal challenges and in terms of the health care services, supports, and needs, as well as long-term care services. And we certainly will be seeing that impacting everybody, and not only in our county and the state, but as individuals. And so I think I kind of want to talk about, there's some issues. We've got the aging population. We see folks that, as we're talking about aging increasing and health care and long-term care, we're seeing individuals obviously, living longer, but living longer and wanting to be independent, and the key to that other piece, when they say independent, they want to be in their own home independent. They choose to not want to be able to or have to go to a long-term care facility, whether even it be a personal care all the way through to skilled nursing. And then I think the other piece is that at the same time, we're all going to need some kind of care, assistance, supports, and even some different activities that are going to be needed to support us to keep us independent and in the home. So knowing that, that's where I'm turning to you to please help us tell me a little bit about the CARE Act itself. What is that? And how did it all start?
Sure, and the reason that we started to look at this legislation and the idea that we needed something in Pennsylvania to support family caregivers is just the fact that so much of the long-term services and supports that individuals get are provided by family members. People think about long-term care and they think, oh, that skilled nursing facility, or even if they're aware that they can get assistance at home, they think, oh, that visiting nurse or that home health aide comes to the home and helps someone who needs that assistance. But the reality in Pennsylvania is that a vast majority of that long-term care that people receive is provided by family members. So often it's the spouse that's helping someone who might have fallen and broken a hip or has congestive heart failure or something along those lines. But it could be a son, a daughter, a niece, a nephew that's providing the care. And many times you'll talk to these individuals and they'll say, no, I'm just taking care of mom, or this is what families do, and they don't think of themselves as a caregiver.
Well, and I think also because you think of that daily hands-on, and sometimes it is, and it happens, I think, so gradually because of maybe a small incident occurs, or you start to notice things, so you go, well, let me help you with that. And then you're doing maybe that. Maybe you're doing the outside work, the lawn and that, and maybe you're checking up to do some laundry because the washer dryer's in the basement and they really shouldn't do steps. And little by little things kind of creep in. And as you said, they don't necessarily also have to be the individual who lives in the home with that person, right? They can also be a caregiver in a different home, like a child or another relative coming in to support, but they can be that immediate caregiver, and many times that is a spouse as well.
Sure,
right?
and as you described, suddenly you're in a situation where this caregiver is coming, if they're either spending all their time taking care and not finding any time for themselves, or it's a son or daughter that might live across town, or maybe in 10 miles away that's checking in on mom or dad every single day, and suddenly they realize, I can't do this anymore. It's a strain on their family. They might be raising children might have some health problems of their own,
might
perhaps,
be working,
and working, the stress level just gets to the point where there's a sudden realization they need help, and this all seems to come together in a crisis situation, and that's where the CARE Act steps in, and the CARE Act is a new law in Pennsylvania that addresses one of those crisis situations, and that's a hospitalization. When a family member is, or it doesn't even necessarily have to be a family member, but the person that's receiving care is hospitalized, what this new law says is that that person can designate a family caregiver. And we know that one of the big crisis situations is not only the hospitalization, but the discharge from the hospital.
Yes.
And so often you get in a situation where the family caregiver is going to be taking care of that person when they get home from the hospital. And all of a sudden, it's a new level of care for that family caregiver. They could be changing bandages. They could be giving injections, taking blood. Who knows what is involved? Because we know that hospitals want to get, and individuals want to get out of that hospital as quickly as possible.
Well, and again, you have certain abilities to do something that you've learned how to do there. You've healed from that medical incident. But what you just described are those things that may need to be done for a long period of time, and that's not going to be done in a hospital.
Yes. So what the CARE Act says is that we'll designate this family caregiver, and whether it's the spouse, whether it's a neighbor, a relative, a son, a daughter, that individual will be notified within at least 24 hours from the time that the discharge is going to take place. And then that individual will receive instruction from hospital personnel on how to take care of that of their loved one when they get home.
Okay.
So, and it's more instruction than just handing them a sheet of paper.
Read it.
Read what you're supposed to do.
This is how you're going to care for that wound.
It's a chance for the caregiver to ask questions, to actually see what they're going to need to do when the individual gets home. And also, I think a key part of this is it's a chance for the caregiver to, one, realize that they are a caregiver, and two, recognize, I might not be able to do this. I've got to find some help, and then the hospital can get involved with the social worker, set them up to talk to someone about home health care, about what it would take to bring someone into the home, and probably connect with the area agency on aging if it's an older individual.
So let me clarify this, because I think some people, in some cases, we've gotten used to turning to the power of attorney as that individual that we're going to talk to, communicate with regards to that individual if they really need some assistance. But so what you're saying is this person that has been designated as that caregiver is not necessarily a power of attorney, does not have to be that same person.
Correct.
So I could be a power of attorney but live in a different county, a different area, and I'm managing from that distance maybe the finances and overall decision making. But you're right, that neighbor or other person that's local may say, I've been doing that. I'm the logical person.
Exactly, because it's a huge difference between the power of attorney and making those decisions, whether they're financial or the quality of care, what might be done in that instance, and that person who's the day-to-day caregiver who's really like we talked about, might be changing a dressing, or the person that's administering medications. Those are the kinds of things that the caregiver gets those instructions, because it's not going to do any good for a power of attorney to get instructions from someone in the hospital to say, this is what has to happen. And the key to this from the hospital's perspective is that one thing that hospitals realized, and frankly Medicare realized for older individuals, is that the hospital readmission rate was going up because hospitals are trying to get these folks out of the hospital as quickly as possible. But
we've seen some issues come out with that, and we get it. It's kind of all tied in together with care and health insurance and coverage and getting out and not staying too long either. That can be detrimental.
So when we passed this law, the Pennsylvania Hospital Association actually endorsed it because they saw it as a way to prevent readmissions. If they can work with the families to get them the care they need at home, they're much less likely to have to come back to the hospital. So.
We don't want that either.
No.
If you take a second, Ray, I think we have a home viewer. So thank you for joining us, home viewer. Go ahead. Do you have a question for Ray?
Yeah, hi, Ray. I noticed that the title is AARP and the CARE Act, Caring for Family Caregivers. I tuned in about 5 minutes ago, and I've heard you talking about the CARE Act and so on, but what is the tie-in of AARP and the CARE Act? You haven't addressed the role of AARP. Are you from AARP, Ray?
Yes, I am. I work for AARP here in Pennsylvania. I'm I do the advocacy work for AARP, and to answer your question, the role of AARP, as we've looked at issues involving long-term services and supports, we've recognized what a critical role family caregivers play. So AARP is a national organization, not only as a state organization. We've worked on this law.
Are you selling insurance to families for caregiving?
Oh no. This is there's no insurance involved in this at all. This is strictly.
Maybe let me clarify. Maybe it's the CARE word.
No. It's the AARP word. AARP and the CARE Act. I'll go back to the question. What is AARP's involvement with the CARE Act?
But the CARE Act stands for the CARE, C-A-R-E, is actually the acronym of the Family Caregiver Advice, Record, and Enable. That's CARE, not giving care. So it's a CARE.
This is a part of our advocacy work. In supporting our members. We know our members.
So do you only do it for AARP members?
Oh no! This is a law that was passed by the General Assembly, signed into law by the governor.
I'm sorry. I'm hearing two conversations at the same time. So let's, Ray, finish yours, and then if you still have a confusion on that, okay, home viewer.
Yeah. So this law applies to everyone in Pennsylvania, and in fact, you don't have to be an older Pennsylvania to be able to benefit. Pennsylvania to be able to benefit from this law. This is for everybody, and AARP just thinks it's good public policy to have this in place.
Okay, so AARP has no direct involvement with family caregivers.
other than to provide advice and recommendations for them, that's really, we feel it's our role as a organization that has 1.8 million members in Pennsylvania and 38 million across the country to provide them with some information about family caregiving that will help them.
No. The advice to family caregivers.
Mm-hmm. Yeah, and that's what we're trying to do, and is provide that advice, and hopefully, also from an advocacy standpoint, try to work for laws in the states that will help individuals who are family caregivers, and we think this is one of them.
Okay. Thank you.
That answer. Thank you for calling home, viewer. I did want to just comment in that it wasn't just AARP alone, it was also with the Hospital Association and the Aging Network in Pennsylvania in particular, and that we can say that through the Berks County Area Agency on Aging in particular, but other area agencies on aging have a program that is Family Caregiver Support is what the program is called, and we contract with a local agency here to manage that program, and it is supporting the family caregiver with a variety of things: advocacy, education, some other support, some care management, because we do know and recognize that it is stressful for that caregiver, and so there's a variety of things. It's not necessarily giving the direct care or not paying for the care per se, but it is to enable the combination of those that are caregiving to be able to do that with some supports, with some advice and advocacy, but knowing that if we can make the transition from hospital, particularly to home, smoothly, efficiently, and with right information, good care, good education to that caregiver, the hope is that that individual, as you said, would not return to the hospital in a very short period of time, which is what has been happening, and prevent that readmission. No one wants to go back, as you said, and be better off staying with good education and support in the home. So,
yeah, and we've always thought this is a win for everyone, even if you're not a family caregiver or someone receiving care. If you're just a Pennsylvania taxpayer, this is a win for you, because the more people we can keep in their home and in their community, utilizing family caregivers and the support systems that the area agencies on aging are so involved with, that keeps individuals out of nursing homes. And we know how expensive nursing homes are, and frankly, the majority of people that end up in a nursing home eventually end up on Medicaid, and that costs Pennsylvania taxpayers quite a bit, and that's increasing every year. And
it's as if folks, again, nobody's jumping to go there, but they, if they can be served in the home, that certainly is a better location for the individual themselves, for probably the others that want to be around them and visit them, and certainly a better atmosphere if you can stay there and be in your home and receiving some of those supports, as you said, because even the financial burdens of the costs of particularly nursing homes, but other facilities also with long-term care is also costly.
Oh, sure.
So I guess so when we had that perfect storm, I guess really we had the recipients that some of them did not even have a follow-up visit from the hospital to the home, nationwide in some cases. They also didn't receive assistance in the home. They may or may not have had formal or informal supports, so that preventing them from going back to the hospital. Do you want to, can you tell us anything more specific? You were mentioning legislation and it's a bill, so where are we in that enactment?
Sure. The law went into effect on April 20th of this year, April 20th of 2017, and so hospitals all across the state should be following the provisions of the law, which as we mentioned are allowing patients to designate a family caregiver, notifying them of when discharge will take place, and doing the instruction before discharge for the family caregiver. Now, one thing we haven't seen yet from the Pennsylvania Department of Health is regulations that on how this will be enforced. We do realize most hospitals, even before the law was enacted, were doing this kinds of things because it makes sense from the hospital perspective. But now, with the law in effect, hospitals are required to do it, but we're still waiting for that, instruction from the Department of Health on how they will enforce the rules if we get into instances where a hospital is not providing this instruction. So we anticipate that will take place. We'll get rules from the Department of Health sometime in the next year. Meanwhile, however, consumers that become aware of this law can contact the Department of Health if they feel that there is they're not getting the instruction or the opportunity to designate a caregiver or the notification of discharge, and the Department of Health will investigate it.
Okay. So again, I think it makes me feel comfortable in that, should I be in that situation, whether, being a daughter of an older adult mother that's, if she ends up in a hospitalization, I want to know as much as I can about making that smooth transition home. So I think it's it would give me and hopefully others at least a little bit more confidence and encouragement and the education to continue to care better for them. In the few minutes that we have, I wanted to just also mention again that we do have a family caregiver support program that is operated through a contracted agency of the Berks County Area Agency on Aging. If anybody needed more information specifically about that program, they can call our agency, which is 610-478-6500. Also, I wanted to have you share your contact information, so folks, if they needed more information from AARP, can we show that real quick on the screen?
And we should also say that AARP has a great part of its website for those that are utilizing the internet on just www.aarp.org/caregiving.
Oh, okay.
And there's tons of information. There's opportunity to participate in chats with. We have some caregiving experts who jump on an internet chat every couple weeks, actually, to answer questions and give advice to people who find themselves in a caregiving situation, because we know that people don't think about this until they're in a crisis situation, and you feel alone, and there's an opportunity to get some help. And we also, I'll show
please
this.
Share that. Yes.
We have a publication that's available through our office, or on the AARP website, that gives tips and advice for family caregivers on how to prepare to be a family caregiver and what you need to do once you're in that situation.
Okay, great, super. Appreciate all of that information. And if we have 1 minute left, would you have any kind of final comment, note for us and for the home viewers with regards to the act or what we should do? Or
well, one thing I always would say is that we are lucky in Pennsylvania. We have the Pennsylvania Lottery, which funds the Family Caregiver Assistance Program, and from our perspective at AARP, whether it's caregiving, whether it's any information on long-term services and supports, we really value the work that the area agencies on aging do, and we always recommend to viewers and to individuals in Pennsylvania, if you're in this crisis, if you're in a caregiving situation and you don't know what to do, the place to call is your area agency on aging. They can help you. They can set you on the right track and get you the information you need to get started.
Good. Well, thank you. I appreciate you sharing that. I know it's new legislation and coming out. We'll see how things kind of happens as we go throughout the next 2018. If you want to contact our agency at the Berks County Area Agency on Aging, our phone number again is 610-478-6500. And thanks for tuning in to Aging Matters.